Imagine being told that you have less than 6 months to live. You've now got a terminal disease. This disease might bring along unbearable pain, neurological issues, and loss of control in your life. Many are choosing to when and how to end their own life. So, would you want the right to choose how and when you die? Euthanasia and physician assisted suicide are among the most ethically complex and emotionally charged issues in modern medicine, raising questions about human rights, medical ethics, and the role of society in end of life decisions. We're going to explore what euthanasia and dying with dignity mean, as well as the legal and ethical debates surrounding the subject that impacts patients and physicians as well. So, euthanasia is ending a terminally ill person's life to relieve pain. This can be voluntarily, which is where you would sign like a consent form if you had a terminal diagnosis or qualified for this situation, or involuntary, which would be someone who is in a coma. So you can see how the slide gets a little slippery when you do get into the involuntary section. For voluntarily participating, you have to be capable of making your own decisions and more than likely a terminal diagnosis. Now, some countries do allow for progressive diseases like psychological disorders like your schizophrenia that are just progressive over time. Those can qualify for euthanasia. In the United States, the person has to be able to administer the medication themselves. They cannot have someone administer it for them. There is a community out there that supports this. They support the right to die for these people who have terminal illnesses. For example, Huntington's disease is a neurodegenerative disorder that is progressive and over time will paralyze the body, leaving the patient basically trapped in their own mind. You're still able to think mentally, you're just not able to control your body, speak, or eat or anything, to the point where you can't even breathe. So, for situations like that, it's would you want to be able to choose if you could die or not? Is it the more compassionate thing to do to help those people out of those situations and provide comfort? Euthanasia, of course, is common in vet practice in the United States for that exact reason, for helping pets that are in pain. But in the United States, euthanasia is not legal. Death with dignity, however, is. So as of 2021, there were 9 states that allowed for this, and there are now 10. So for this, an individual would have to consult with a physician for an end-of-life prescription. The law implementation varies from state to state, and so situations like this are usually managed privately between the physician and the patient. There is regulations with the medication use, and they do track as well. So only the patient can take the medication. They need to be capable, like I said before. They also track this medication, so they're basically tracking when the individual dies so that they know that the medication was taken. If the medication is not taken, it is then given back and destroyed. 1 in 3 people end up not taking their medication and giving it back. Physicians and nurses are not compelled to participate in this. Obviously, it goes against ethical values that are taught to both physicians and nurses by not doing any harm. And like I said, legal protection varies based on jurisdiction. So there's so much gray area. Physicians also feel like it undermines palliative care efforts and trying to give people the most comfort on their end of life journey. There is a risk of abuse and coercion as well. So, individuals who are at risk populations, whether that be people with disabilities, the elderly, or even someone whose disease has progressed enough that they are not thinking clearly and able to make those decisions any longer. There are arguments that say that people can be using this as a cost saving measure, which is not ethically correct either. So, if you're an individual who has a lifelong chronic illness, you have multiple hospitalizations, you might look at this as a way out for a cost saving measure versus for more of a compassionate approach. Um, there's minimal regulations against euthanasia and death with dignity. So that's another controversy surrounding it. In other countries like the Netherlands, it is more strict with the guidelines. Many religions oppose euthanasia and death with dignity, saying that it contradicts the belief that life is precious and should not be harmed. Most religions also believe in the purpose of suffering and think that with suicide you'll be condemned. And then there's religions that just believe that this is murder and you would be condemned also. Physicians face a great deal of dilemma with this as well. There's a lot of gray area, so physicians can become intimidated and scared to do something like this, perform or prescribe these medications. 77% feel unsupported by the American Medical Association, despite some chapters switching their stance to neutral on euthanasia. But the fact of it remains that the opinion is very divided in the medical community as to whether this is for compassionate care or if it is up to a higher power. Some countries just flat out believe this is murder and you would be prosecuted as such. And then there are some across the globe that would take into circumstances, but you would not be protected legally from ramifications. Euthanasia and death with dignity continue to challenge our moral, legal, and medical frameworks. Whether one supports or opposes euthanasia, conversations about end-of-life care forces us to confront our questions about autonomy, suffering, and the value of human life. Professionals, citizens, and healthcare providers need to stay informed and compassionate when discussing these vital but critical issues with end-of-life care.